Thank you very much for the introduction. I'll be happy to take you through what I've prepared for you today. My name is Dr. Gathai Mundia. I'm a pharmacist from Kenya, and I'm the brand director at Students Against Superbugs Africa. So I'll take you through the youth action for implementation of AMR national action plans, and this is a lesson from Kenya. So if I very fast, you can tell me. Sometimes I talk very fast, you can also tell me. So about SES Africa, so we are Students Against Superbugs Africa. It's a youth-driven initiative for fighting antimicrobial resistance. So we started this initiative when I was a student. That was I joined the organization in 2019 when it was starting, and these are we empower young people to be lead advocates in the fight against antimicrobial resistance. We do this through education. Like 2 years ago, we had a 6-month course where we took students from Africa, the whole of Africa. We took students through a course where they received certificates at the end, and they were taught about AMR and how it happens, how to solve it, and it was very nice. They all graduated. Then we do research. This one, we have not fully started doing full research, but we have had some students do some research initiatives from the course that we taught them, and we are looking forward to implementing some of the findings they got. We also do community engagements like hand washing. We also teach the community members about AMR and how to mitigate. SES Africa is working to make towards making a difference in the fight against AMR in Africa. You can visit our website from the link posted here. Also, we will post our link in the chat box. So if you follow the link, you'll see all we do. You'll see all our projects, the ongoing and the cross projects, so that you can see how we do our work. So I won't dive much into what is AMR because you all know, but maybe I can just say that AMR is when bacteria, viruses, fungi, and parasites, they develop the ability to resist the drugs that they were previously susceptible to. This makes treatment hard, and also you can have people staying in the hospital for longer than average. You can also see people die because maybe you started them on this drug and it didn't work and the diseases needed urgent intervention. So these are all the complications that you can get from AMR. So AMR is a global threat, and it is estimated that by 2050, it will cause 10 million deaths all over the world, and this is huge. The cost of treatment or the cost of healthcare will shoot up to $100 trillion worldwide. So you can imagine we'll be earning all our money to take to the hospitals, and that would be very bad. So this is a silent pandemic that if we don't take care, we can get into the post-antibiotic era sooner than we think. Because you remember, if you can read the history, you'll see that antibiotics we don't have them for a decade, for a century. It's less than a century since the first one was discovered, and now we are almost losing them all. So if we don't take care, we can get to an era where we will never get an antibiotic. We'll never do a surgery because it will be very dangerous. Cancer patients will not get the drugs they need for the infections. HIV patients will not get the drugs they need because they don't have immunity. They depend on antibiotics. So we need to take care. So this is the Kenya National Action Plan. You can see on this side. It was launched in 2017, and it was to cover from 2017 to 2022. So this National Action Plan on AMR is a very comprehensive document. It is adopted from the WHO. So let's see here. So it is aligned with the WHO Global Action Plan for AMR, and these are the principles. One of them is One Health. So this means we are not protecting ourselves only. We protect the environment, we protect animals, we protect plants. so that we can be safe. If we don't protect all of them, we will not be safe on our own. Another principle is that prevention is better than cure. So we are preventing AMR from, preventing infections rather than trying to cure them with drugs that might not work because of resistance. So prevention is always better than cure. Another principle is innovation. So about innovation, we need to come up with other ways of dealing with microbes rather than just using antimicrobials. For example, use of vaccines. Vaccines is a technology that helps prevent infections before they happen, so that we don't need to use antimicrobials to treat them. And another way of innovation also is like use of probiotics, prebiotics. So when you use these prebiotics and probiotics, they at least, because they are normal flora of the human body, when they are present, they prevent other harmful bacteria, harmful viruses, harmful fungi from invading our bodies, because they make the environment toxic for these harmful microbes. So this is another, we need to come up with more innovations and more technology so that we can deal with this threat of antimicrobial resistance. So here are the strategies of the Kenyan National, of the AMR National Action Plan from Kenya. So the first strategy is about strengthening surveillance systems for antimicrobial resistance and use. Here, we are trying to make sure that we know the number of antibiotics used, the number of infections reported, the number of resistance instances reported, and this will guide on, will show us whether the interventions we are using to curb AMR, whether they are working or they are not working, if we need to shift focus and all this. Another strategy is promoting rational use of antimicrobial agents. This through education, like educating the communities that they need to visit the hospitals when they have this infection. They need to not self-medicate. They need not to share drugs. So if you promote rational use of antimicrobial agents, you will at least mitigate the threat. Another thing, it's not only about the communities, also the doctors, not to prescribe without maybe a diagnosis. If the infection is recurrent, you need to at least do a culture and sensitivity test. So things like this. Another one is strengthening infection prevention and control measures. So this is another strategy that the National Action Plan is trying to help people prevent infections through vaccines, through hand washing, and through all the other things that need to be done so that you don't get infections. We also, so these are the strategies of the Kenyan AMR National Action Plan. And the first strategy is strengthening surveillance systems. I hope you heard about that. Also promoting rational use of antimicrobials by educating the communities how to use antimicrobials, when to seek medical advice, not to share drugs, not to self-medicate, and also teaching the healthcare workers how when to use what antimicrobials, why they should do diagnosis, why they should do culture and sensitivity, and all this. Another one is strengthening infection prevention and control measures. So this one, you teach the masses how to prevent infections by maybe washing hands, using vaccines, and all the other things we can do. Now we were now talking about enhancing laboratory capacities for diagnosis and surveillance of AMR. So as you can see on your side, you have these tests we did in our hospital. A patient who was not ill, a patient was very healthy, but he just decided to do a urine for culture test and sensitivity. So they brought a sample and it was cultured and the sensitivity was done. So maybe if you can zoom a little, just a little bit. So this just last month, you can see the drugs on your left and the sensitivity on the right. And you can see a lot of drugs are very resistant. You can see a lot of drugs are very resistant. You can see augmentin is sensitive, cephaloxime is resistant, cephazolin resistant, and many other drugs are resistant. So you can imagine if this patient or if this guy was sick and he presented with an infection in this hospital, and maybe we didn't do a culture and sensitivity test, maybe they had an infection that needed azithromycin, for example, they will not be cured. They'll go home with the drug, they'll start using it, and they will use to the last, they'll use it the way they should. They will take the drugs once a day for 3 days, if that's the regimen needed, and they will take it the right way they should take it without missing a point from the doctor, and they'll not be cured. And now we'll go on saying that antimicrobial resistance is caused by patients not taking the drugs the way they should. And that's not the real case here. This patient will not be cured because we didn't do culture and sensitivity test. The problem is partially from the public and from the doctors, but if the communities are using drugs the way they shouldn't use them, now this is a problem because everyone is going to have this problem at the end of it all. Youth engagement in implementation of AMR National Action Plan. So this is how we can engage the youth. One of them is by raising awareness. Now, I think we need to go, let me just read here. So the youth have a lot of energy and they have fresh perspectives. They have a lot of ideas and they can use technology more than the older people because the youth are born in the digital or they have found they are natives of the digital era. They can use digital devices very effectively. They have a lot of energy, they have a lot of power, and they have a lot of willingness. So if you engage the youth, we'll sure go where we want to go. So on your right, you can see we have a poster. This is a poster for an event that happened 2 months ago in Uganda. It was about my turn, Uganda AMR Symposium. And these students came to showcase, how they can deal with antimicrobial resistance. Most of them were doing research, others were coming up with some technologies, and it was really nice. I think if you go to our website, you look at the programs and projects, you'll get to see a link for this particular website. You have a website for this one, and you can learn a lot from the students. They have a lot to show, and it was very nice. The first way youth can be engaged in National Action Plan implementation is by raising awareness. We said that youth have a lot of energy and they can contribute to prevention of antimicrobial resistance by telling other people in our communities more about AMR. So this can be achieved through targeted campaigns and educational programs. For example, you can send youth to high schools or secondary schools to talk to other students. And this is very targeted, and they will educate them about this. And when these high school students go home, they'll tell their parents. So this one will bring a ripple effect. These parents will talk to other people in the community. They will tell them. And this will go on and on and on. And everybody, at the end of it all, everybody will know about AMR. So another way is about community involvement. So youth participation in local initiatives to combat AMR can help to foster a sense of ownership and responsibility. So if you take youth to the communities to talk about AMR, they will feel a sense of ownership. They will own this problem and they will want to deal with it. So they will help the community. They will show them how to do things, how they will tell them. And when people come to your village, they come to your home, they start telling you, do you know about antimicrobial resistance? It's caused by this and this and this, and these are the outcomes if you don't adhere to this. And people they'll get scared at first, but then they'll know we need to do something, because no one can come with an information to your home and it's a total lie. They are not asking for money. They are just telling you about something that might happen if you don't do something. So we can use youth to do this. For example, just today, I saw a multitude of, it was not a multitude, it was some few guys. They were walking with placards in town. They were just few, less than 20. And some of them, most of them were old. They were talking about, I think they were talking about drug abuse. And I just stared at them and said in my mind, why did they just go to a certain university around and ask students to support? Students will not ask for anything. They'll just join in, and it would have been massive. They would have made a lot of impact. They were just few. So if you see youth, they'll make a lot of noise. Everybody will come out to see. They will talk to people alongside the road. These ones were just walking, and you just have to see what they're talking about in a flash of a second. They're just moving. So youth are very powerful. The third way youth can be involved in implementation of the National Action Plan on AMR is about policy and advocacy. So we can use the youth, we can empower them. We can empower the youth to be advocates of AMR, of effective AMR policies in the national level. This can involve providing priorities for young people to engage with policy makers and decision makers, as well as supporting youth-led advocacy campaigns. By advocating for strong AMR policies, youth can help to shape the national response for this pressing issue. As we said, the youth has a lot of ideas, new ideas that can be used by policy makers. If at all they have the goodwill to help, they can make policies that are favorable to AMR mitigation. Innovation and research. So we said youth, as we said, youth have the capacity to come up with innovations and to do research because they are young and versatile. They are able to, the young people can contribute to development of new solutions to combat AMR. And this is evident because like right now we have a program that's ongoing, and you can see how the students involved, they are trying to come up, they are thinking hard, they are trying to do research to come up with new innovations. And that's very impressive and encouraging. Okay, collaboration and partnership. So fostering partnerships between youth organizations and other stakeholders can strengthen collective action against AMR. So I'll give a story of Kenya. So in Kenya, there are several AMR initiatives and organizations. They are led by youth, and we have other NGOs coming in from other countries. And when the partnerships, for example, we are doing a partnership with other organizations, and we are able to cover grounds, we are able to engage more students, and we are able to come up with more solutions, or we are able to to help more people to know about AMR. So when we help students or we help youth to get more partnerships, or if we accept youth partnerships, we will have a brighter future in AMR, in fight against AMR. Thank you. So these are the challenges in the implementation of the Kenya AMR National Action Plan. So the first challenge is about inadequate funding from the government and private stakeholders. So I think what people should do, they should look for alternative ways of funding the AMR initiatives, or they need to press more so that the government can provide more funding. Another challenge is lack of public involvement by the National Action Plan Committee. So I think the National Action Plan Committee should seek to involve the public more. The other challenge is problem with quacks and unqualified people in the pharmacies and other drug dispensing units. Another problem is many healthcare workers lack knowledge on AMR existence and its cause. They just dispense, they just treat, but they don't know much about AMR. Another thing is low youth empowerment. And lastly, another challenge is conflicting policies and laws. You may find in some countries, people are buying drugs just anywhere, there are no regulation. And whereas the laws are saying that prescription only drugs should not be sold without prescriptions. So these are conflicting policy. And I hope policymakers will one day realize that they should at least make everything straight. So these are recommendations for the improvement of the AMR National Action Plan. The first one, these are general recommendations that the Ministry of Health should make a national action plan on AMR, youth-centered and youth-friendly, to allow more youth involvement in fighting against AMR. Because as we said, the youth is the future, and the future is, the youth are young, they are versatile, they have a lot of power, they have a lot of ideas. Another recommendation is the integration of AMR studies in the education curriculum, just like they did with HIV and AIDS. Increased healthcare budget aimed at promoting AMR national action implementation, enhanced youth engagement and government partnerships with organizations seeking to address AMR issues, improved awareness creation through youth engagement to ensure each and everyone is acquainted with the reality of AMR, provision of drug disposal guidelines that are easy to follow for the general public to reduce on environmental contamination with an antimicrobials. So this one particular is very important, and most of the time when I dispense drugs to my patients, I always ask them that if it's very possible, they try their best. If drugs remain, they should bring them to my place so that we can dispose them well. Although I have not seen anyone bringing, but I hope that the government or there are guidance that can be provide for this, so that there is a way the general public can dispose the drugs safely. The last recommendation is declaring AMR a serious concern, just like sexual health and reproductive health, HIV and AIDS, drug and substance abuse, and the NTDs. All these are declared a serious concern, and everyone is talking about them. So I hope people can try and make sure that AMR is also a national concern. So in my conclusion, the Kenya National Action Plan, so we talked about all this. So I hope the Kenya National Action Plan and also the national action plans from other countries can be enhanced to make sure that at least they are followed, and to make sure that they have measurable evaluation parameters, so that we can see whether we are headed to the right direction. So thank you very much, and I hope my presentation was will help you as you come up with strategies on how to mitigate AMR. Thank you.